Hi friends, today our topic is the hypertension, which is the high blood pressure. So what is high blood pressure? When the blood pressure in your arteries is greater than the normal, which is elevated, so it is termed as hypertension. So we will consider the normal blood pressure over here and we will see the values. So the upper value means the 120 mm of mercury is the systolic BP, and the downward value is the 80 mm of Hg mercury, which is a diastolic BP. So what is systolic BP? Systolic BP is the arterial pressure when the heart is contracting, and the diastolic BP is the arterial pressure when the heart is relaxed. So generally most of the time we take BP from the brachial artery in the upper arm. So this is the hypertension general information. Here now we will focus on the stages of hypertension. So first, normal BP. When the systolic BP is less than 120 mm of mercury and the diastolic BP is less than 80 mm of mercury, so it is considered as normal BP. Second one is the elevated. When the systolic BP is between 120 to 129 millimeters of mercury and the diastolic BP is less than 80 mm of mercury, it is considered as elevated. Stage 1, when the systolic BP is between 130 to 139 millimeters of mercury and the diastolic BP is 80 to 89 millimeters of mercury. Stage 2, when the systolic BP is greater than 140 millimeters of mercury and the diastolic BP is greater than the 90 mm of mercury, it is considered as stage 2. So now we will consider what is isolated systolic BP and isolated diastolic BP. When any one value between of the blood pressure, if the systolic BP is high and the diastolic BP is the normal, so it is called as the isolated systolic BP. And when the diastolic BP is high and the systolic BP is normal, it is called as a diastolic BP. So the high BP is a serious problem to the blood vessels. If the BP is high, then it also damages the endothelial lining of the blood vessels, which further leads to the myocardial infarction, such as known as heart attack, aneurysm, and the stroke. So the stroke is the interruption of the blood supply to the brain. Here now we will focus on the causes of hypertension. So we will categorize hypertension into the primary hypertension. So hypertension without a cause is the primary hypertension, and it accounts for 90% of the cases. So risk factors for that are old age, obesity, salt heavy diet, and sedentary lifestyle. Except old age, the other three can be improved with lifestyles changing. So the exercise, decrease, less intake of salt in the diet, and the sedentary lifestyle. To change the lifestyle, so it can improve. Here now we will focus on the secondary hypertension. It accounts for 10% cases. The hypertension with underlying cause. So the causes such as atherosclerosis, vasculitis, aortic dissection, and fibromuscular dysplasia, which is seen in young women. The fibromuscular dysplasia, so it causes low renal blood flow. So low renal blood flow causes kidneys to secrete hormone renin. So what hormone renin does, it causes kidneys to retain more water. So the fluid volume in the blood vessels increases, so which leads to the hypertension. So this is the secondary hypertension. Here now we will focus on the hypertension crisis. So in hypertension crisis, the systolic BP increases up to 180 or greater than 180 millimeters of mercury, and the diastolic BP increases above 120 mm of mercury. So there is urgency if no damage to the end organs, and there is the emergency if damage to the end organs takes place. Here now we will focus on the symptoms or the clinical manifestation of the hypertension. So first, primary hypertension, there is no symptoms, but it can be occur if we neglect the primary hypertension. Secondary hypertension associated with the underlying causes. In emergency, there is the confusion, drowsiness, chest pain, and breathlessness. These are the symptoms of the hypertension. Now we will focus on the treatment or the management of the hypertension. The first one is the lifestyle changes. Because of changes in the lifestyle, like modification of the diet, exercise, and stress reduction, so hypertension can decrease to some extent. And if the hypertension is in the emergency on the secondary stage, so there is the antihypertensive medications which physician will prescribe you. Thank you guys, hope you like this video.